Hi everyone out there, this is Dr. Spinach, currently shooting this video from India. I know the whole world is under complete lockdown because of this coronavirus pandemic thingy, and I was wondering if am I the only one who is struggling to keep myself motivated to work on things that I love, or the loneliness that comes from being stuck at home. And after having conversation with some of the people around me, I found that people are finding it difficult to be completely productive at such a time when they literally have nothing to do except for some basic chores at home. Heads up, this isn't any motivational video. I just thought that if I express my feelings on this public platform, it might help some people who are having the same difficulty as me and are not able to communicate it.
Disclaimer:
This video has been put
out after a very
long struggle from
laziness and evolution.
So all my medicine buddies, stick with me to completely understand about diagnostic testing's whys and hows. Let's be productive together.
Diagnostic Testing.
So the topics that we're going to discuss in this section are: why do we do laboratory tests? What are the characteristics on which the lab tests operate? What's defined by predictive value and of positive and negative test results, and how to create highly sensitive and specific tests. Let's start with our first topic, that's purpose of laboratory tests. Question is, why do physicians order lab tests in clinics or hospital settings? The answer is either to screen for a disease, to confirm a disease, or to monitor disease status. We are going to look into the details of all these three with examples. Now let's start with screening for a disease. General criteria that should be kept in mind while developing a screening test are: effective therapy that is safe and inexpensive must be available so that it is available for a wider section of population. Disease must have a high enough prevalence to justify the expense, because a large amount of money is spent on development and research of lab tests. Disease should be detectable before symptoms surface in the patient. It's self-explanable. Test must have extremely high sensitivity so that it's able to detect all the people with the disease, which is an important factor for developing a screening test. Being a highly sensitive test, it may also detect people who do not have the disease, but they tested positive, they are false positives. But it's crucial that there should not be many false positives. Now, let's move on to see some examples for screening tests. The first one, newborn screening for inborn errors of metabolism. These include phenylketonuria, galactosemia, congenital hypothyroidism, and many more. You will read about these in pediatrics, but if you want me to make a separate video about inborn errors of metabolism, let me know in the comment section below. For adult screening tests, the examples are mammography, that's done for breast cancer, which is advisable for women above 40 years of age. Cervical cancer is screened using the pap smear, which can be started as soon as 21 years of age until the woman turns 65 years old. Colonoscopy is done to detect or remove precancerous polyps in the colon. Fasting lipid profile evaluates the risk of coronary artery disease. 4 variables are checked in the lipid profile, namely total cholesterol, HDL cholesterol, LDL, and total triglycerides. The last one is to screen people with symptoms of a disease. I know this is a bit contrasting from the general criteria which we discussed in the previous slide that said disease must be detected before symptoms surface on patient. But there are some exceptions. For instance, in this case, the symptoms of an autoimmune disease are very much similar to allergic symptoms such as rashes, itching, or feeling of fatigue. And if something like this have a cyclic pattern, serum anti-nuclear antibody test can be done to rule out autoimmune disease. Moving on to the next purpose of lab tests, that's to confirm disease. Some of the examples are, in the previous slide we saw that anti-nuclear antibody test was done in order to screen for autoimmune disease. Well, it was not telling us which autoimmune disease is it. So specific antibody tests are done. For example, anti-Smith and double-stranded DNA antibody for specific type of autoimmune disease, and this one is for SLE. Now, if the patient has high fever along with high WBCs and pain in micturition and other urinary problems, the physician is going to order urine culture to confirm the microorganism that has infected urinary tract, and hence to confirm urinary tract infection. Serum troponin T and I are used to confirm acute myocardial infarction. Tissue biopsy has always been the golden standard for confirmation of cancers. The last purpose of lab tests we saw was to monitor disease status. Some of the examples over here is hemoglobin A1C, which is used to evaluate long-term glycemic control in diabetic patients. INR is used to evaluate warfarin therapy in patients with thrombotic events like stroke or AMI. Pulse oximeter monitors arterial oxygen saturation, can be used under hospital settings when the patient is under anesthesia. So that completes our first section of the purpose of laboratory test. We saw there are three purposes, and that they are to screen a disease, to confirm a disease, or to monitor disease status. Let's jump to our next section, that's operating characteristics of lab tests. Let's look into the terms that we are going to come across a lot in this video. So for people with a specific disease, two terms are used. They are true positive and false negative. True positive are the people who actually have the disease and they tested positive in the test. False negative are the people who actually have the disease but they tested negative, so they are falsely negative on the test. For people without the disease, we use true negative and false positives. So true negative are the people who do not have the disease and they tested negative on the test. And false positive are the people who do not have the disease but they tested positive on the test. The first operating characteristic of a test is sensitivity. How to know how much sensitive is the developed test?
Let's move towards the whiteboard to better understand this.
Sensitivity of a test, we are going to take 10 individuals who already have the disease, say colon cancer. A new test developed over here is fecal occult blood test. This test tested 8 individuals positive who already have the disease. So we know they have the disease and they tested positive over here. So they are truly positive for the disease. And 2 of them tested negative. But we know that they have the disease. So they are falsely negative. The sensitivity in this case, as we see, is 80%. That's 8 individuals out of total 10. So it's obtained by this formula. That's true positives upon total disease, and the total number of the people who are deceased over here are 10. That's true positive plus false negative. So true positive upon true positive plus false negative. That's 80% in our case. Now, if a test gives 0 false negatives, that means all of the individuals who tested positive are truly positive. That means the sensitivity in this case will be 100%. Now, a test with 100% sensitivity is used to screen for a disease. So let's move forward with specificity. In order to obtain specificity of a test, we are going to take 10 individuals who do not have the disease, for which a new test is intended, that's biopsy. So let's say using this test, 7 people tested negative. And we know they do not have the disease, so they are truly negative. And 3 people tested positive. But we know that they do not have the disease, so they are falsely positive. Specificity in this case can be seen as 70%. How did we get the specificity over here? We divided true negative upon total non-disease. So total non-disease over here are true negatives plus false positive. That's 70% in our case. Let's say if a test gives 0 false positives, that means all of the people who were tested are truly negative. That means specificity in this case is 100%. Now, if a test is 100% specific, that's used to confirm a disease.
Predictive values of positive and negative test results.
In the previous section, we saw test results as either positive or negative. So the question over here is, what does a positive and negative test results tell you? That's where the predictive values comes in. Let's start with positive predictive value. So 1,000 people in a population were tested, out of which 150 were correctly tested positive, they are true positives, and 700 were correctly tested negative, they are true negatives. That means 50 were false negatives and 100 were false positives. The total deceased were 200 and non-deceased were 800. So, how to interpret a positive test result? We have to calculate positive predictive value for that. So, it's calculated by dividing true positive by total positive. That is, true positive 150 upon total positive, that's true positive plus false positive. That's about 150 plus 100. And that comes about 60% in 200. That means 60% of total individuals tested positive are truly deceased. Similarly, how to interpret a negative test result? So we calculate negative predictive value for that, and that's calculated by dividing true negative by total negatives, and that means we have true negatives as 700 over here, and total negatives are false negative plus true negative, that's 700 plus 50. So it comes out to be 93.3%. That means 93.3% of people tested negative were truly negative. So the big question over here is, why do we want to know that? It helps us to determine what's the probability of a disease is given the positive and negative test results.
I think we're done. Gonna leave the camera now. I'm gonna have to come back. Because
It's one more important thing to note over here, that predictive values of positive and negative test results are a factor of prevalence. That means these change with change in prevalence.
let's try to prove this.
So let's solve a question to better understand this. Given an example of test, that's serum antinuclear antibody test. The sensitivity of this test is 100%, specificity is 80%, and the total number of people on which we are testing this is 1,000. So the prevalence in the first case is 1%. That means 1% of out of 1,000 have SLE. That means they are deceased. So 1% of 1,000 comes out to be 10. And as it is mentioned that sensitivity of this test is 100%, that means there are no false negatives. So all of the 10 are truly positive. So this is 10. Given that 10 out of 1,000 are deceased, that means 990 are non-deceased. Now this will help us to find out true negative from specificity. The formula for specificity is true negatives upon total non-deceased. That means true negatives will come out to be 792. Therefore, the false positives are 198. Now, this will help us to calculate positive predictive value. The formula of which is true positive upon true positive plus false positive. That's 208. Now, into 100. This comes out to be about 5%. So, the population where the prevalence of SLE is 1%, the positive predictive value turns out to be 5%. Now let's move forward where the prevalence of SLE in a population is 50%. So that means 50% of 1,000 are deceased. So 50% of 1,000 comes out to be 500, that's deceased population, but we know the sensitivity in this case is also the same, that's 100%, so false negatives are 0, so all the deceased are true positives, that's 500. That gives us the number of non-deceased out of 1,000 will be 500, and this will help us to calculate specificity again. So this will come out to be 400. That means false positive will be 100. Calculating the positive predictive value from this test comes out to be true positive, that means 500, upon true positive plus false positive, that means 600. So this is almost equal to 83%. Now we can see over here clearly that the population in which the prevalence is 50%, the positive predictive value is 83%. And where the prevalence is 1%, the positive predictive value is 5%. So this proves that predictive value is a factor of prevalence and it will change with change in prevalence.
Creating highly sensitive and specific tests.
Now let's talk about creating tests that are highly sensitive and highly specific. I'm going to begin this by explaining ideal test. Ideal test is something that has 100% sensitivity and 100% specificity, which is actually non-existent because there is always an overlap between these two curves, that's normal population and deceased population. However, we can create a test that is either 100% sensitive or 100% specific. So let's start by understanding how to create a test which is 100% sensitive. Let's first understand this curve. So we have a healthy population in blue, the diabetic population in red, and the original cutoff point over here is 126 milligram per deciliter. We have that's blood sugar level on the y-axis. When we establish the cutoff point to be 126 milligram per deciliter, we see that there are some people who are diabetic, but they are coming under healthy population. That means they are false negative. That means they are diabetic, but they tested negative for the diabetes. Coming back to creating a test which is 100% sensitive. When a test is 100% sensitive, that means the false negatives are 0. So in order to reduce all the false negatives, we will have to shift our reference interval to the point from where the disease curve starts. That means it's 120. So the new reference interval in a test which is 100% sensitive will be now from 120 rather than from 126. Now looking at this, we have all the people who have the disease in this range. That means we have successfully created a test that's 100% sensitive. We do not want anyone to be with a disease to be left out. Moving towards creating a highly specific test. Our original cutoff point was 126. When we set this as a cutoff, what happens is we can see over here that the people who do not have the disease tend to come positive in this case. So they are actually false positives. In order to create a test which is 100% specific, this will mean that all the false positives should be 0. In order to do that, we will shift our cutoff point at the end of normal curve. That means our new reference interval will end at 130 milligram per deciliter. Hence, this will exclude all the individuals who do not have the disease. Generally, specific tests are done after a sensitive test. 100% sensitive test excludes all false negatives. That means it only holds true positives and false positives. When we perform 100% specific test after this, it excludes all false positives. So now we are only left with people who are deceased. That means the true positives. So that completes our whole section over diagnostic testing. Thank you very much for bearing with me. And if you like this video, please click on like and subscribe. Click on the notification bell. So I'm going to upload medical videos every week, and if you want me to upload something specific, please write in the comment sections below. And everyone, stay safe, stay healthy, stay at home.
Bye-bye.